We're Texas CASA, and we're working with visionary thinkers to explore issues in the foster care system that need fixing and propose solutions. This is The Fix.
Rather than thinking about foster care or the system and fixing the system, and I've heard some people say, quit looking under the hood, we just need a whole new car. We need to think about what are the children and families needing from us. That's what we're trying to fix. Family preservation is not a new idea. Kinship placements are not a new idea, but it's still, when you stop and think about it, what children want is to stay in their families. And even if we can't prevent child abuse or neglect from occurring, there are better, more evidence-based interventions and supports to help that child maintain that relationship with their family and stay in their home and strengthen those protective factors. And part of that means that all of us need to expand our expertise or bring in partners that work with adults. I love kids. I started in this field because I want to work with kids, but what kids need is for us to help their parents and to know how to work with their parents. And we've really got to get better at addressing this two-generation approach and having more partnerships with those adult service providers and better understanding those risk factors and how communities can position parents for success, starting in pregnancy, maybe even preconception, but starting in pregnancy, birth hospital, and not waiting for just our intake and investigation system to pick up a problem and then react. To me, that's the biggest shift, is toward thinking about serving the adults, thinking about serving the relationship, the relational health between the child and a significant parent. And there's no more damage we can do than by removing that child from that parent. So it really should be a last effort. One quote that really kind of opened my eyes to this idea was from a youth who said, "Don't save me from my family, save my family for me." It's easy to get discouraged because when we only work with families in significant crisis and we only see children who've been extremely traumatized, it's hard to imagine. There was a point in time earlier where we could have really helped. And what I'm saying is we see families that are in the prevention programs that really are struggling with the same risk factors. And when they go through some parenting help, they will tell you, I really didn't know. It really can just take education. I can testify that while it can seem overwhelming and impossible to do good work when you're on the back end and you see so much trauma and so much complexity, it does get a little bit sunnier and a little bit easier and more straightforward and simple if you can, in fact, help parents much sooner. But what children need is for us to figure out how to help their parents. And that means a different skill set. That means learning to serve adults and the parents. That's not easy, but it is what children need. We are going to help them the most if we help their parents and help them keep that parent-child relationship intact. And that's the fix.